What are the pros of safe drug consumption facilities and what are the cons of safe drug consumption facilities? The number one pro of safe drug consumption facilities is harm reduction. They're able to regulate drugs, they're able to stop the drug dealing on streets and the nuisances that happen in public areas. It's supervised because they're supervised facilities. That especially applies to intake and how much you take of these. There's also referral treatments. A lot of cancer patients rely on marijuana gummies or food to get through the pain that they're in. One of my best friend's moms had a stroke and she's having to do the same thing because she's in so much pain she can't sleep. There are a lot of cons of safe drug consumption facilities. I have notes written down, so I'm looking at them. There is resource allocation. This means like maintaining and establishing safe drug consumption facilities requires resources and funding, and oftentimes the government isn't willing to do that. So the funding gets taken away because they don't agree with what these people are using the drugs for or agree with the drugs at all. So there's funding. There's also moral and legal concerns. Legally, what can you use regarding drugs and how much can you use? It's not really black and white. Morally, people think that drugs are wrong and they see wrongdoings in having a place like that. It's a lot of opposition from communities and a lot of backlash. And how much good are the drugs really doing? Second question, if you were a policymaker, what would you do to address drug abuse and or addiction in the US? I would say educating people is very important and can also help prevent it. There was a study done and it was in the 1950s, and the percentage of people that knew the harmful effects of smoking cigarettes were less likely to do so. Even though it was one of the most popular phenomenons in the 70s, they were still much less likely to act and smoke cigarettes. And I feel like that's the same thing today. And alcoholism, smoking weed often, which is what a majority of people do, including vapes, which is like a newer form of smoking. There's just not a lot of education in the school systems about this. And it's probably because these are the two most popular drugs. Alcohol isn't necessarily a drug, but it might as well be. Two most popular drugs in the world, America. So there's not a lot of education on it, and I think that would help prevention, having a lot of evidence-based research on these and having accessible treatment. There's a lot of people who seek anxiety medicine through weed and or pills or supplements, and if we had more access to these drugs in a safe way, like facilities, people could seek them in a safe, healthy way instead of through people they don't know. This would help with decriminalization. These are my notes, by the way. Decriminalization and exploring alternatives instead of incarceration for low-level drug offenders. And just support for recovery. I would say that would be a good place to start if I were a politician, to see where can we support people who can't control themselves or have a disease that they need help with. And more research and data. I don't think that there's enough, and if there was, maybe less people would be doing it, or maybe more people would get the help that they need. We don't know what kind of help they need because we're not doing enough research. This topic is really important to approach gently And if I were a politician, I would try to have accessible treatment, more education, support for recovery, and things like that.